Subscribe to our YouTube channel and don't forget to press the bell icon to get all the latest updates. We are inside the ICU of the HPS hospital in Bengaluru. Now remember, this is a city that has really reeled under the weight of COVID. And this is a city that has actually seen an alarmingly high level of fatalities. In fact, a recent study tells us that the casualties, the mortality here has been 3 times higher than, let's say, the city of Chennai for the same time period between February and the 25th of May. To understand what's happening here on the ground, even though things are somewhat better now, but they're still pretty serious. We're joined by Dr. Taha Mateen, who looks after the HPS hospital here. Talk a little bit, it's a tense time, so appreciate your making the time. Talk a little bit about the kind of casualty figures, the fatalities as we walk through the ICU, and we'll just walk here and you can tell us. Yeah.
The mortality this time has been rather high, almost 20% in the ICU.
20% in the ICU is a staggering figure.
In the ICU, yes, it's an astonishing figure actually. 20% is a very, very large number. Once you come to the ICU and on a ventilator, they really die. But the bad thing here is we have very, very young patients. That one is 40, this is 34, this is under 30, 28 years old.
So let me ask the camera to come here as I go over what you've just told me.
Right.
You've just described 3 patients and you've said that they're all 3 are between their 30s and their early 40s.
40, yeah, it's 40, 34 and 28 actually. These are the 3 people in the ICU, very, very sick. The first one is having an encephalopathy. The second one is intubated. Intubated mortality is more than 90%.
Intubated mortality is more than 90%. Let those numbers sink in.
Yeah. All right. And here we have a young woman who came from Ramnagaram, which is about 40 kilometers away, not finding an ICU bed elsewhere. So she came here last evening and she was in the emergency with 35% oxygen. On 15 liters of oxygen, her saturation was very, very low. And therefore, these people, the next one is also a young man who is about 38 years old.
So I'm really staggered by the fact that literally every bed in this ICU that we've seen so far has not been the elderly as we once thought, but it has been people in their 30s and their 40s. Now, one reason for this that's sometimes offered is that the elderly were vaccinated earlier. Does that explain it, or is the strain, this mutant strain, playing out differently for younger people?
It doesn't look like it's because of the not having been vaccinated. It is because of the mutant strain. The reason I say that is because last time we had this and younger people were not equally affected. So why are they affected this time? So this is a mutant strain which is affecting the younger people more aggressively.
So would you say that there are more young people in this ICU today than older?
Absolutely. There are more young people than the older people here in the ICU today.
And the average age of the patient here would be?
Would be average age would be between 40 and 50. There are some people in the younger, but 40 and 50 is a very, very young age.
I mean, that's actually younger than I am. I'm 49 years old and I don't even think of myself as old. But it really makes you reimagine your assumptions. Now, before we are seeing here the other the team of that works with Dr. Mateen. We have Dr. Faisal here. We'll talk to him in a second. But I just want to understand something from you. What is the biggest challenge on the ground? You spoke about a 20% mortality rate in the ICU. Elaborate on that.
Well, the biggest problem is people are not coming early enough. They are being treated with all kinds of protocol medicines which do not include steroids and the anticoagulants. Mm-hmm. So the
blood thinners?
Yeah, blood thinners. And they are on these medicines for such a long time that they come to you when they are very, very, very sick. Mm-hmm. And they are managed in hospitals which do not have those facilities, and commercialization of healthcare has really kind of been a challenge on the ground for us. Mm-hmm. Number 1, we don't have proper infrastructure. Number 2, we do not have proper regulations for this infrastructure, and that has created a crisis wherein very young people are not finding beds, are not being treated appropriately, and these myths of COVID and the stigmatization of COVID has also been a big challenge.
So let me ask the camera to come here and show you where we're standing again. We're in the ICU of the HPS hospital. And by the way, though they say that the numbers are somewhat down, the ICU is absolutely full. Dr. Faisal, for you, has anything changed? Has the pressure, thoda pressure kam hua hai ki bilkul nahi?
नहीं बिल्कुल नहीं प्रेशर तो
बिल्कुल नहीं कम हुआ
हाँ बिल्कुल नहीं कम हुआ rather this time we are, as Dr. Taha Mateen rightly said, we have seen much younger patients. For example, this gentleman here, he's my classmate in school.
So we'll turn around. We're not going to reveal his identity without his consent, but he is the intensivist classmate, which means if we can,
about 40 years old.
He would be how old?
He is as old as me. He's about 40, going to be 40 now.
Okay.
And this time we see a lot, as Dr. Mateen said, we are seeing a lot more young patients who have been victims of COVID-19.
Acha, when they say that things have improved a little bit in Bangalore, what about the pressure to get an ICU bed? Now, an ICU bed, quite simply, by definition, means an oxygenated bed. Does that still remain a struggle?
Absolutely a struggle. Not just a nice oxygenated bed, but a bed which can give you high flow oxygen, which can give you a ventilator, which can have capabilities to intubate. Those beds are still not available. What we are seeing for the last 1 week is people are coming from towns far away from Bangalore, from Ramnagaram, from Mysore, from Kolar, from Chanpatna. All these people are coming now from across the border in Hosur and in Krishnagiri and all these. Those people are coming to Bangalore to us now.
So it's the rural Karnataka that is then sending patients into the city, and therefore the pressure for you in terms of the demand for ICU beds has not decreased.
It has not decreased because rural Karnataka is sending it to us in the last 1 week. Otherwise, we were full within Bangalore itself.
In the hospital right now, how many ICU beds are taken?
Every single ICU bed is taken. We have about 35 ventilators in this hospital, and all of them are taken.
35 ventilators, every single ICU bed taken. Sabse badi mushkil. What is the biggest challenge that you're still facing?
We're still facing in terms of oxygen supply and.
Is that still a problem?
No, to a certain extent we have extended our resources. We have gone way beyond our capacity in fulfilling the requirements. But by God's grace, the oxygen requirement in this hospital, we have tried to manage as much as possible. We have not had a shortage like the other centers.
So what worries you? What keeps you awake at night?
The young people getting affected and.
What keeps you awake at night?
The mortality. We've been seeing grief upon grief upon grief and death upon death, coming closer and closer to our families and relatives and people who we know as well.
You were talking about the class differential this time as well.
Yes. Because in the first wave, it was predominantly in the lower socioeconomic class, in the poor class, and the people who live in slums. Almost 80% to 20% who are like in the middle and upper middle class. This time, the ratio is reversed. About 80% is middle and upper middle, and 20% is from the lower socioeconomic.
I sometimes call the second wave the 2611 of the health world.
I would agree with you. It's been terrible. This many deaths we haven't seen. 2611 was nothing in comparison to the COVID crisis.
And 20% mortality in your ICU. Have you ever seen that before?
No, we haven't seen this kind of mortality. Bodies upon bodies that we're picking up. It's very painful, Barkha. It's hard to take.
It is heartbreaking, and it's a reality check here in Bangalore where, yes, the peak of the city may have shown, you would say, some signs of decrease, but for those who work the ICU, the pressure is just as much for an ICU, for an oxygenated bed. Now, in the middle of this heartbreak, there is one patient behind us who wants to share her story, who's doing better. I'll first ask Dr. Mateen to just go and maybe look her up, and then we can have a word with her. जी वालेकुम अस्सलाम. नाम क्या है आपका?
मेरा नाम शमशाद है.
अच्छा, आप तो बहुत बेहतर लग रही हैं. मुझे खुशी हुई.
मैं बहुत खुश हूँ. और जो है यहाँ हर किसी का जो है ये है आगे बढ़ के ये करना है.
मतलब आगे बढ़ते रहना है.
आगे बढ़ते रहना है, खिदमत करते रहना है. वक्त का कोई देखने वाले नहीं है और अपना थकान नहीं है. और
कितने दिन से आप आईसीयू में?
मैं 1 महीने से हूँ.
1 महीना?
हाँ.
तो इनको 1 महीना हो गया है. दैट इज हाउ लॉन्ग.
जैसा करते हैं ये लोग,
घर जैसे.
और कोई चीज़ की कमी नहीं, दिन रात दवाई नहीं, ऑक्सीजन नहीं, किसी की खिदमत में कमी नहीं, कोई ये नहीं.
अपना फैमिली में और किसी को भी हुआ कोविड?
नहीं है. देखिए, मैं अकेली औरत हूँ, लेकिन ये मेरे भाई से ज़्यादा.
आपके हस्बैंड को भी कोविड हुआ और अच्छे हो गए ना?
हाँ, उनको भी हुआ था.
यहाँ तो लेकिन बाकी फैमिली में हुआ था ना लोगों को?
हाँ, फैमिली में.
अच्छा, अभी सबसे जब आपको बहुत बुरा लगा कि आप बहुत बीमार हो, तो क्या लगता था? सांस नहीं आता था?
हाँ, सांस नहीं आता था, खांसी होती थी और बुखार था, सर दर्द था. लेकिन जो है इन लोगों की हिम्मत ने जो है मुझे आज उठा के खड़ा कर दिया।
बहुत खुशी हुई आपको देखकर कि क्योंकि so it's also important to tell positive stories. Dr. Mateen, however, you've been talking about the mortality rate being really high. Are you able to figure out why Bangalore in particular is seeing these sort of critical cases?
Not really. I don't think those numbers in Chennai and Bangalore really represent any flaw in Bangalore or any flaw in the way we have managed it. I don't understand why that higher mortality in Bangalore versus Chennai that is reported in the press is hard to explain unless we do some viral genome studies and find out if it's a different variant or something. So we don't understand that.
In 2020, in the first wave, Dr. Mateen had made a very emotional plea to doctors. He was here, he said, I have the ventilators, I have the beds, but the doctors aren't coming. That's not happening here. You have a full staff.
Yeah, we have full staff now, and that's because people understand COVID better, and the scare in the doctor fraternity has gone down, and COVID is paying doctors better too. So we pay them better, and they have come because the scare level has come down significantly.
I'll ask both of you a last question, Faisal. What's the one thing you'd want people of Karnataka to understand जो लोग अभी तक नहीं समझ पा रहे?
I would request everybody to get vaccinated as soon as possible.
Where are the vaccines?
Yeah, that's the problem now. People are willing, they're coming forward to get vaccinated, but there's a short supply of vaccine. Request the authorities concerned to provide the required number of vaccines.
Yeah.
I think vaccination is going to be the only solution for the present crisis.
The one thing that is absolutely different between the first wave and the second wave, you have pointed out, is one, higher mortality, two, younger people. Is there anything else that leaps out at you?
And the third is obviously the socioeconomic difference.
What about black fungus? Do you think it's going to be a major crisis?
I think black fungus is a major crisis because although the numbers are not as many as COVID itself, yet the mortality and the morbidity, just imagine losing an eye and just imagine getting disfigured so completely. And the mortality is exceptionally high once you get that. And with the current crisis, we don't have the medicines for it. We do not have amphotericin B, we do not have posaconazole and all the medicines that are required to treat it. And
do we now have the medicines for COVID?
No, we do,
for COVID? For black fungus, I know we're short.
No, for COVID also we are short, but just about getting it now.
What are you the most short of?
We are short of tocilizumab especially. We are not able to get as many as we want. There are a lot of restrictions to it, but little bit eased out these days, but we did not get it through the crisis at all actually.
So this is a reality check that is coming from the HPS hospital, where it's now rural Karnataka that is pushing in people's demand for ICU beds in hospitals like this one, where every ICU bed is taken. And it's so taken that if you go through this corridor, Dr. Mateen, you can show us that ICU beds have also been created in other parts of the hospital that were not traditionally the ICU. And we're entering this side now. And you can see that even this ward has been converted into an ICU bed. I just want a last word from you. You have also expanded.
Yes, we have.
You've expanded the ICU beds because there's such a high demand. Can you talk a little bit about how the entire hospital in a way is an ICU?
We use ventilators in every single bed in this hospital. Wherever is required, we use HFNC, we use ventilators, non-invasive ventilators in every bed in this hospital. We have 85 beds, and every bed is, you can use a ventilator from every bed. So we are equipped with that. We are equipped with proper oxygen outlets, and we can give high flow.
So effectively, the entire hospital is an ICU?
Effectively, with the current definitions, we are an ICU entirely. All 85 beds can be an ICU.
And all 85 beds are taken?
All 85 beds at the moment are not taken. We have about 10 vacancies at the moment.
And
otherwise, the basement floor of 18 beds is full. The first floor of 18 beds is full. The second floor of 22 beds is full. The fourth floor is not full. We have about 10 beds open there still.
All right, so here at the HPS hospital, some alarming data. The younger people who are in the ICU, the average age between 30s to early 40s, the high mortality rate, the mortality rate of this ICU at 20%, which Dr. Mateen himself says is staggeringly high. And still the cry and the battle for an oxygenated bed in a city where now cases are coming in from outside the city, from tier 2 cities, from smaller towns, and of course from the villages. For those who are in a hurry to declare this crisis over, for the doctors on shift in the ICU, it is anything but. It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.